chapters, not especially in the last chapter, we have discussed about how the what are the process that is included in the reproduction, how the gametes are formed, what are the sexual reproductive conditions system, male and female reproductive system, their pH, so what is required, what is not required, everything we have discussed little bit in the last chapter. But in this chapter we are going to discuss about reproductive health. Reproductive health has become a very crucial thing in this developed world. So many of the people in and around the world, they have a very difficulty in the reproduction, because many of the females don't have proper ovulation. Men, the sperm count is less, sperm is not moving, no correct formation of head of the sperm, no acrosomes are present. So there are a lot of issues are happening in and around us. So when you look around us, you can see many of the infertility clinics are booming up in many parts, especially in the developed areas, especially in cities, very especially in cities. And still now in Indian villages, they don't feel much problem in the reproductive health. So reproductive health is having both the sides. First is we have to maintain the number of species, that is very much important. Number two, it should not be overpopulated, there should not be any overpopulation. Number three, sexually transmitted diseases has to be prevented or stopped. So on this basis, India government initiated a program in 1951, which is considered to be the first country to initiate this. That is a family planning. That means in a family there should be only maximum two child, not more than that. So it was very difficult in the field of in the villages to have so. And there are a lot of sexual discriminations among male child, female child, like that. Still it is going on in the village side. Still there are some conditions. Even I also have heard many conditions like that where I was living at present. So on this basis, government has initiated family planning program. Same way, government has initiated child health care program also. So in this child health care program, what the government is doing is government is educating the people. Educating the people means they are saying to the people, this is good, this is bad, and you should not be worried about these things, etc. This is what government is doing. On this basis, it is very rare in Indian education system. It is followed in some of the schools, but in many of the schools in the village side and all, it is not followed properly. They give sex education. Even if you go to the Western countries, those who are studying in 8th and above, 8th, 9th, 10th, that classes, compulsory there will be a class of sexual education. So it is very compulsory for them to attend. So nobody has to be discouraged from that. And different people from different organizations, child welfare committee, doctors, gynecologists, andrologists, those who are treating with the male hormones, they come and take class. They will say to the students or say to the child, actually what is this, why we need this, why we have to do these type of things. So many things they will teach us. So that is a one type of education. The second type of education is government will give posters, pamphlets, and wherever you go, nowadays in India there is one slogan is running, Beti Bachao Beti Padhao. So this is a campaign which was launched almost 5 years back in order to educate the female child, and many female based initiatives are grown up, because in North India, especially in North India, I will not saying that the South Indians are good in this case. but better, that's all. North India, in some many of the villages, in the interior villages, the female feticide is going on. That means they will kill if they come to know that a mother is pregnant with a female child. Still it is practiced. So these type of educations are given. And sexually transmitted diseases, what are they, how we can prevent that, on this basis also the education is given. And another one more main thing is cleanliness of sexual organs, and how to maintain the body during the growing stage, 8 plus and above. So when the adolescent stages reaches, different types of body odors comes out from females and males. So how to maintain that, don't worry about that. These things will go off after some time, and many of the females will get, not only females, boys also will get pimples. And many even asked me also how to control this, but it is an hormonal change, we can't do anything. And after giving birth, what to be done, what should not be done, that is prenatal and postnatal treatments of the mother, those things are initiated by the government. And apart from this, sometimes even though we don't have any sexually transmitted disease, and male and female are healthy also, there are some conditions. For example, the fetus is having some type of abnormalities. If they have some type of abnormalities, if that child was born to this earth, that child will suffer many things from in and around. So that will mentally hurt the child, or sometimes the survival of the child will be very, very difficult. So the government has initiated a practice, and usually it is known as aminosynthesis. That means whenever the fetus is grown, around the fetus, inside the amnion, there is a fluid is there. They will take that fluid and observe under the microscope. Especially they will go for the chromosomes, whether all the chromosomes are perfect or not. So that particular technique is known as aminosynthesis, that will be followed. But this aminosynthesis is also having a negative effect. Negative effect is, when we take the chromosome, the 23rd chromosome is a sex chromosome. So a person will come to know about the sex of the child, male or female. So that also will cause some negative side effect. Because of this reason, now at present, there is, government has legally prohibited the sex determination of a child. Even though the doctor knows the sex of a child, the doctor is not allowed to say it to a parent, to their parents, what is that. And apart from that, sexual abuse cases are rising very much in these countries, and crimes related to that. These all are causing our community, eating our community very badly, even though we are educated. So instead of these things, the government has initiated many programs to find out this. And even to control the population, unwanted pregnancy, these things, government has initiated many techniques where the safe sexual relationship can be taken place. Or if you come to know about this disease, what you have to do, what should not do. So those things, the government has developed many medicines also, and many techniques. So these are the things we are mainly going to discuss. And next one that is coming is the population stabilization and the birth control. So India is a country, as per the 2011 census, somewhere around 1.3 to 1.4 billion peoples are there. But one thing we have achieved by the 2011 is the maternal mortality, that means the death of a mother during the time of giving birth, and infant mortality, both are controlled very much when we are compared to 1970s, 1980s, or the beginning of the 2000s. Still it is taking place, but lot of controls are done. lot of controls and done. So because of doing these controls, the population is growing. Earlier, I'm not saying that the growth of population is bad. The growth of population is bad in many other aspects. For example, in India we have 1.4 billion, I think so, as per the exact data, 1.4 billion. So we need space, we need education facilities, we need job, we need food to eat. So there will be many issues will come if the population are increasing. In India we have very high population, especially in India, China, Asian countries. The number of total number of people living in a square kilometer is very high. But when you go to Western countries, they don't have this much population, this much of people in 1 square kilometer. In India, in some places we have 15 to 20, but when you go to the Western countries, we will be having only 5 to 6 or 10 maximum, that's all. So according to their system, according to the country, size of the country, that is very, very low. So the government is calling many people from India to come and settle there. They need young bloods to do some work inside the country, and India also needed. So Indians, still the population is very high. It is not possible to do anything. So India government is initiating. India government says that a small family, that means father, mother and 2 child, will be a good family. So that is what the slogan is come, hum do hamara do, that is we two and we have two, that is a slogan came. So these type of things the governments are introduced into the system by the 2000s it was started. Government has calculated that the number of people per square meter in India is increasing, so we have to control it. Apart from this, it is impossible to say any humans that they should not undergo any sexual relationship. It is very difficult to the humans because it is inbuilt in us. So sexual relationship is having one more advantage also, disadvantages also. So if any couples don't want a child, they can go many methods to control the pregnancy. Many methods, even to the male also, even to the child also, there are many methods. So we are going to discuss something about the methods which is safe, that is helping to provide to control the birth rate. And whenever we are using these contraceptive methods, that method is known as contraceptive methods, it should be easily available, and it should be reversible with the least side effects, and it should not affect the sexual drive of a person. So these 3 things should be there whenever a contraceptive method is designed. So government is very much taking initiative nowadays for that. So the first one, that is called as the natural method. That means naturally how we can avoid the unwanted pregnancy. So the first method is periodic abstinence. Periodic abstinence means a female is having menstrual cycle from the day of 13 to the day of 20 or 25, which is considered to be the chance of 80% of pregnancy, chances for 80% for the female to get conceived. So if the couple having a coitus 1 week before 13th, 1 week after 13th, after 20th, so they are saying that it will be a good time, but it is no assurity that the female will not be pregnant. We can't say anything, but it is a chance. So it depends upon person to person. With those understanding we can do. Another thing is withdrawal or coitus interruptus. Withdrawal means It is another method. It should be done by the male partner. That means before ejaculating the sperm into the female vagina, before ejaculation, the penis has to be removed from the vagina. So the semen will be flow outside of the body. If the semen flow outside of the body, there is no chance for pregnancy. Next is lactational amenorrhea. Lactation amenorrhea means absence of menstrual cycle. That means when the female has given birth, for 6 months, near to 5 to 6 months, the female will be feeding the child. Feeding will go for a longer time also in some condition, breastfeeding that. So whenever the female is breastfeeding the breastfeeding the baby, that time if the mother is undergoing any recoitus, there is a less chance to get pregnancy. So these are the natural methods which can be do. And next comes the barrier method. Barrier method means it will form a wall in between. The first thing is the condom. So condoms, everybody knows that condom is a barrier method. It is made up of a rubber or latex or something. It can be introduced to a male penis and the semen will be ejaculated into that. And nowadays we are having female condoms also. The condom can be inserted into the female vagina, and after coitus take the condom and dispose it properly wherever it has to be disposed. And nowadays when we go to any public space in big cities, we can see condom vending machines. Many are there. Some countries are giving free, some are giving in less money. Another thing is that by using diaphragm, cervical caps and vault. Diaphragm, when they are using these diaphragm, cervical caps and the vault, they will be inserted into the female reproductive tract. That means when that cervix area is covered during the time of coitus, there will be no conceptions because the sperm can't move inside. Another one is by using some spermicidal creams, jellies, etc., which causes a barrier to them. Then most effective, and it can be a permanent solution also if it is not causing any side effects. That is intrauterine devices. These intrauterine devices, we need the help of any medical practitioner, like a doctor or a nurse who knows to do this thing properly. So what they are doing is they will take a metal. You can see in picture figure 4.2, that is copper T. These copper T's, copper 7, these are inserted into the vaginal area near to the uterus. So this copper releases, or this particular instrument release some type of hormones which can phagocytically kill the sperm or suppress the motility of the sperm, so that the sperm will never come and meet with the ovum which is be ready in the fallopian tubule. That is also possible. Next one is oral administration of pills. Oral administration of pills is given in estrogen progesterone combination. So when these pills are taken in a time basis in the sense means they will say that before entering to the coitus, 4 hours before, 1 day before, when we take these pills, so it will prevent the unwanted pregnancy. That is also there. But the using of pills for a longer time is not good. And one of the pill which was developed by the India government, that means Central Drug Institute, which is known as Saheli. It is a contraceptive pill and non-steroid in nature, which is having high contraceptive value. Most of the time all these pills are of combination of progesterone with a little amount of estrogen, so that these progesterone and estrogen will never allow the sperm to move. That means they will block the pathways. Chemically they will block the secretions which directs the sperm to the ovum, that will be stopped, so that they will get prevented or protected from the pregnancy. Next one is the surgical method or sterilization. This is a permanent method. Two things are there. One is known as the vasectomy and tubectomy. That means if you're considering about the vasectomy, the surgically the vas deferens will be cut and tied, and tubectomy, the fallopian tubules will be cut and tied. So when they are doing this, when they have cut, there will be no chance for the, if you take in the male condition, the sperm will be produced, gametes will be produced, but during the time of coitus, the other secretions will come from the accessory glands, but there will be no sperm inside that. If there is no sperm inside that, there is no possibility of any type of pregnancy or unwanted pregnancies. And even in the fallopian tubules also, ovum will be released as normal, but ovum will wait near to the fallopian tubule also, but sperm will never come because the tube has surgically cut and switched, and they have tied off, so that there will be no movement of the sperm inside. So these can be for a permanent solution. Nowadays the people started to ask, or doctors started to ask, whether you want to have a second or a third baby, or shall we go for this tubectomy or vasectomy. Mostly it is done in tubectomy, and when this tubectomy is done, there will be no problem for the normal menstrual cycle, because for the menstrual cycle the outer lining of uterus is coming out, so there is nothing should be done with the menstrual cycle will be normal. If the ovum is there or not there, the menstrual cycle will be normal for a female. And here in the male also, when they had done with the vasectomy, the sperm production will be there, but the sperm will never pass through epididymis to the urethra. Vas deferens is cut off, but other secretions will be there, no other issues will come. Sometimes when we do this type of things, doing this contraceptive method, some people will be having some side effects, very rarely, sometimes very mild, like nausea, abdominal pain, those things. And it is very common in females also, when they are undergoing the menstrual cycle, muscle cramp, that will be possible. And another thing which is illegal in India nowadays, it is known as the medical termination of pregnancy, otherwise abortion. So as per the 1971 as Indian rule, it is not possible by any person to kill a fetus which is of 12 week and above. It is not possible. If so they want to do, they have to take a special permission from the court, by showing the court what is the reason why you are doing medical termination of pregnancy, why you are doing abortion. I mean artificial abortion. Natural abortions takes place if the chromosomes are not matched properly, if the proper division of the cells have not taken place, so those type. And if the female during the time of second trimester, if the female has undergone some major accidents, those times there is a chance for the natural pregnancy. This is a medical termination. That means medically or artificially we are terminating the pregnancy. That is not allowed without any proper reason. Majority of the time the reasons should be something genetical. So when they have done the aminosynthesis, they have found out that the child is having a rare genetic disorder. So if the child has born to this world, they will be having many risk factors. So that time the court may give or may not give after the hearing inside the court. So we need a valid medical certificate, a doctor, and we have to present this in front of the court. So these things has to be done. So medical termination of pregnancy is not allowed in India, and in some countries it is allowed. Some countries it is allowed according to their rules, but in India and many of the developed countries, medical termination of pregnancy is not at all allowed. And the next one we need, that is sexually transmitted diseases. Whenever a person is undergoing a sexual intercourse or coitus, there is a chance that the sexually transmitting disease will be transmitted from a male to female or female to male. There is a chance. So there are many sexually transmitted diseases are there, like gonorrhea, reproductive tract infections, fungal infections, hepatitis, HIV. These all are very deadly, and you know about HIV. In HIV, most of the cases HIVs are spread by sexual intercourse, maximum. Very rarely or in very rare condition they are transmitted through the fluid exchange, that means the blood exchange or something. Most of the time it is gone. So in order to prevent from sexually transmitted diseases, it is every time it is recommended to use condoms. It is condoms, and it is allowed also that you should not have, or no human should have, multiple partners, that especially the partners those are unknown. So it should not be, and if we have any doubt we should be asked to any of the doctors what is that, why, whether it is needed or not needed, because in India still we consider this as taboo. And yesterday or day before yesterday also I have seen that in Rajasthan, which part of Rajasthan, or is it in UP, I don't remember that, the females, those who are having the menstrual cycle, they will not go into the house for 2 days, I think so, 2 to 3 days. They will camp in one area very near to the village only. After this menstrual cycle is over, then only they will enter into the house. So these types of taboos are still practiced in India. So many of the people are not at all interested to talk about this. But as an educated person, we should have to talk very clearly, so that these type of things, and there is a bill also in the parliament that before going for marriage, there should be a test whether the partner is HIV positive or not. But still that is not at all passed in the parliament, so it is not a rule in India or a law in India. It is not. So next one comes is infertility. Still above we have discussed about the conditions, how we can control unwanted pregnancies, how we can do some type, how we can control from STDs, that is sexually transmitted diseases. We have studied that. And next comes is infertility. Infertility is also a major cause. Many people in India, they are having the problem of infertility because of many reasons. Many reasons. Maybe drug, maybe the natural condition, maybe the food what they eat, anything. So in order to maintain the population number, we need good amount of next generation, which is the blood and soul for the any countries. So they need, so and every parent in this world, very few, especially in the Western countries only, they will decide that they don't want child. But in Indian condition, every family will be wanted for a child, but they have some issues in reproduction, we call it as infertility. So for this we have techniques which we call it as assisted reproductive techniques or technologies. So one of the most common thing is in vitro fertilization. In vitro fertilization means the egg and sperm, ovum and the sperm will be collected from the male and female, and they will be allowed to fertilize outside. Then that will be transferred into a mother, and which we call it as embryo transfer, and that particular baby which was grown, we'll call it as the test tube baby. And another one more thing inside that is from where the ovum is collected. If it is from the husband and wife, it is okay, or if somebody have donated this ovum and sperm, nobody will disclose it where it is, from where they got it. And the next technique is shift, that is zygote intrafallopian transfer. Here what they will do is, after fusing the sperm and ovum outside of the body, when it reaches to the blastomeous stage, this will be transferred into the fallopian tubes. If the fallopian tubes don't have any other medical conditions, they will be transferring to it. So once it is gone to the fallopian tubules, it will slowly move to the uterus, get implanted over there, and it will develop into a fetus. And the next one that is coming is gamete interfallopian transfer. It is a procedure where the egg or an ovum has lost the capacity for fertilization. It is unknown what is the reason why, even though there is a sperm, even though there is an ovum, but we don't know why the fertilization is not taking place properly. So that time they will undergo this technique that is known as GIFT, that is gamete intrafallopian transfer. That means the ovum will be collected from the donor, and after that ovum will be collected from the donor into the fallopian tubules of another female who cannot produce one but can provide suitable environment for fertilization and the further development. Next is intracytoplasmic sperm injection. That means it will take place in the laboratory where the sperm will be directly injected into the ovum, and this type of techniques will be assisted if a male is having less sperm count, or there is no motility, those things are there, they will assist this. And these all are known as artificial insemination techniques. These all are known as coming under a single umbrella, one umbrella, known as artificial insemination. And next one is intrauterine insemination. In this technique, what they will do is, the semen will be collected from the husband and artificially it will be introduced into the vagina, and that is known as intrauterine inseminations. So these are the techniques which is commonly followed if the infertility is there. So these are very much important question, and many of these are asked in CBSE examination. So please go through that. I have attached a note also, you can go through that, and any doubt please comment back. Thank you.